What can X-rays show for early raw diagnosis? Imagine trying to spot tiny changes in a busy scene. That's similar to what doctors face when using X-rays to find early rheumatoid arthritis. In the beginning stages, X-rays are mainly used as a baseline tool to see how the joints look over time. But in early rheumatoid arthritis, the X-rays often look normal because the disease is just starting and hasn't caused visible damage yet. Early rheumatoid arthritis involves inflammation of the synovium, which is the lining of the joint. This inflammation causes swelling and pain, but these changes are soft tissue issues that X-rays can't see. The initial damage to the bones or joint space narrowing usually happens later. So, even if someone has symptoms like joint pain and stiffness, their X-ray might not show any signs of damage at first. As the disease progresses, X-rays can reveal more obvious signs. These include joint space narrowing, which means the space between the bones gets smaller, and bone erosions, which are tiny areas where the bone has started to break down near the joints. These signs indicate that the disease has advanced and caused structural damage. But it's important to know that these changes are usually seen in later stages, not early on. X-rays are very useful for tracking how rheumatoid arthritis develops over time. Doctors often take multiple X-rays over months or years to see if the joint damage is getting worse. This helps them decide if the current treatment is working or if adjustments are needed. However, X-rays are not sensitive enough to detect the early inflammation that causes the disease. Other imaging techniques like ultrasound and magnetic resonance imaging are better suited for early detection. They can see the inflammation in the joint lining and tiny bone erosions that X-rays might miss. This early detection is crucial because starting treatment early can help prevent long-term joint damage and preserve function. In summary, X-rays are an important tool for understanding the extent of joint damage in rheumatoid arthritis, but they have limitations in early diagnosis. They mainly show structural changes that happen later in the disease. For early signs of inflammation, doctors relying on more sensitive imaging methods. Always remember, if you suspect rheumatoid arthritis, it's essential to consult a healthcare professional who can interpret these images in the context of your symptoms and medical history.